Okay, so a lot is going on. Also, we talked about it before. It's been 2 years since the Affordable Care Act, or Obamacare, was rolled out. So is our health care system better or worse?
When its rollout started with a nightmare of a website, supporters of the Affordable Care Act said history would forget the glitch and predicted more health care coverage at less of a cost. But 2 years later, when trying to measure the success of the ACA, aka Obamacare, different groups of people can see different results, depending on age, employment, earning power, etc. This much we know, according to a Gallup survey. The number of the uninsured has fallen from 18% of American adults to around 11%. Healthcare costs are still going up, but at the slowest rate of inflation in decades, according to the chairman of the President's Council of Economic Advisors. Still, according to the employee benefits firm Mercer, not only are premiums for those who get insurance through work expected to go up by about 4% in 2016, but copays are expected to rise as well, a trend employees are familiar with, paying more for less coverage. So does Obamacare at least have our health care headed in the right direction, or do we need a second opinion?
Okay, I've divided our time, so let's dive right in to talk about the healthcare situation in America. Duri Biscarin, health and science reporter for St. Louis Public Radio. Thank you for being here. Tim McBride, welcome back to the show, professor of public health, Washington University. And then also welcome back to Dr. Heidi Miller, a primary care internist and family care health centers. And Bill Hill, welcome back as well, president and CEO of Advisor Benefits. So let's maybe start with that glitch that we were experiencing when the Obamacare first rolled out. Was it just a glitch? Am I using the right word? Have we forgotten that? Or could people potentially experience problems again this time of year when they're trying to enroll?
Well, the glitch lasted, if you call it a glitch, lasted a couple months or maybe 6 weeks or so, where it was pretty much non-functional. But the open enrollment period the first year was about 6 months. So people were eventually able to enroll and they got it back up running.
So we don't worry about that.
So our director of operations at Family Care Health Center reports that the system is actually working much better than it ever has before. So not only are our internal certified application counselors more equipped to and more experienced to help patients apply, they report that the website has worked much better. It has been much faster to enroll patients, and when there are questions, calling the national line, the pickup is much faster, and the people who are answering the questions on the phone are also more equipped and experienced. So it's smoother this year for sure.
So what about when they get the product that it may be easier to get? What are you all making of what they have actually gotten once they are able to sign up? Give it 2 years. You've had 2 years to look at this.
Yeah, I think they expected more coverage for what they were going to purchase, and ultimately what's happened is that those of us who are at the bottom level of the federal poverty level would be most entitled or have the most available to them are actually buying plans that have the largest deductibles and the largest out-of-pocket. So consequently, it might as well be $1 million deductible because they can't afford the $6,000 deductible for the plan that they're getting for free.
Dr. Miller, I see you kind of nodding.
My patients have very severe financial constraints, and trying to afford the premium is a struggle. But any education effort that can go through so that people understand the difference between a premium and a deductible matters. I've had patients with high deductibles who have declined extremely important care. So I have a gentleman in his 50s who developed new double vision. When he looked in a particular direction, one eye pointed in another direction. That is an alarming finding. As his primary care provider, I recommended an ophthalmology consult as well as a brain MRI, and he declined both because it wasn't even feasible for him to pay the full price up until his $2,000 to $3,000 deductible.
So one thing I would add that's really important for people buying plans to understand is there are 4 tier levels of plans, from bronze to silver to gold to platinum. We don't really have any platinum plans in Missouri, but you can get a low deductible plan if you buy a gold plan. There are actually 0 deductible plans. But most people, about 60% of people are buying, or about 80% are either buying the silver plans or the bronze plans. In fact, I think this was the goal of Obamacare, like it or not. They wanted to give people a range of choices with a range of prices. I agree with both the previous speakers that it's important that people understand what they're doing when they make these choices, because they could end up in a $4,000 deductible plan with a low premium. So if you only base it just on premium, you might make the sort of wrong choice for you, and we're doing some research around that.
I think what we're realizing is that even though the uninsured rate seems to be going down, that isn't the whole story. You can have insurance and still not be able to pay a copay or be able to go see a specialist and afford that, and then afford the different kind of tests you might need or surgeries. That's the way our healthcare system works, and it also appears that within these plans we have relatively narrow networks. Now that insurance companies have to cover more people, they're finding ways to kind of cut back expenses by saying...
Work the system a little bit?
For lack of a better word, perhaps. Basically, you might have a plan and only be able to get low-cost care at a set number of hospitals or primary care providers. And say you're in an emergency and you end up at a hospital that isn't in your plan, you'll be paying a higher
Go ahead, Bill.
I was just going to say, Casey, if I can interject, you know, and part of this is that people have a lack of understanding of, in our country, have a huge financial problem. They don't understand underwriting. They don't understand the pricing. So when you say, you know, they're trying to skirt the system, these actuaries have been given a task. The task is you have to fit the benefits within a certain guideline. So there's only so many ways that they now can accomplish that. And one of the ways is through the networks. So you have a choice. You can either have a plan that is completely off the charts unaffordable or not available because the actuary can't get to the number that the government is requiring, or you can have limited networks. And what this all means is that people have to get involved actively in their care. We don't have health insurance anymore. We have health financing, and there's a huge difference. So if you are buying a plan, and this is the main point, research that plan, make some good projections on what your needs are going to be. If you know that you have to have a procedure, then that patient should sign up for the plan with the least out-of-pocket that they can afford or that they can buy.
A couple things I'll add is it's important for people to remember that there are subsidies that are very significant for people. So I agree with Bill that if your income's pretty high, the prices could be pretty high for premiums, but if your income's right above the poverty line, you can get a premium for pretty low dollars per month. And I think the other thing is we're playing out market forces in healthcare. This is what they wanted in Congress. They wanted to be able to offer a range of choices, and some plans are more generous than others. Some are more.
But that's not what's happening, though.
I think it is actually, because
the market does not exist as you contend that it does right now in the health insurance field.
The health insurance markets actually work probably better than the rest of the healthcare markets. I mean, people have a choice of about 20, 25 different plans that range from just a couple $100 to $400 a month for a 40-year-old. So I think people can make choices, but they have to make educated choices. I totally agree with that. And I think one of the things they're doing is paying too much attention to the premiums. And I urge people to look at premiums, copays, deductibles, networks, and then that make an informed decision.
There is a silver lining to this cost awareness, and that is that doctors and patients have been blind to the cost of services until after the fact. And so as a society, we really need greater awareness of that, both the caretakers as well as the recipients. And so now I actually do have conversations with patients where, okay, you want me to get an MRI, but that costs this much, but it's actually cheaper over here, more expensive over here. But patients, I think they have a right to know what the costs are of their services in order to make an educated decision.